Hello, everyone. I'm hoping we can get some folks to join us for tonight's conversation about minority mental health. I'm going to talk about more stats and myths associated with minority mental health. We're also going to talk about interpretations of mental health in minority communities and how those compare with interpretations in white communities. We'll also talk about barriers to seeking help. Why do we even have this mental health awareness month? Why do we need it? And then I'm also going to talk very briefly about Maia Moore and Nelsan Ellis as well. Looks like I'm frozen, so I'm sorry if there's some technical difficulties. Let's see. Let's see if we're even still on. Okay. It says we're still live, but I can't see. So I'm not sure if I should just let it keep going on my computer or what. So my screen is completely white. It is completely white. It is completely. Okay, I'm going to close out of it on my computer because I can't really be helpful this way and just record it on my phone. Let's see. Okay, I'm going to. Sorry for the feedback. I'm just trying to figure out what to do. On my computer because I can't really be helpful this way and just record it on my phone. Let's see. Okay, I'm going to. Sorry for the feedback. I'm just trying to figure out what to do on my computer. Okay, it's back. It's back. I'm so sorry. We'll let it keep going. Okay, we'll go with the flow. Hopefully we can get some folks to join in. So if no one joins in, that's okay too. I will go ahead and do the live session, and hopefully we can get some folks to join in a little bit later. And then even if not, hopefully folks will be able to use this as a resource a little bit later. Okay, because my goal really is 30 minutes tonight. Okay. So just for starters, I wanted to talk about why do we have Minority Mental Health Awareness Month, and why am I taking the time to do these live sessions each week. So first, July is considered Minority Mental Health Awareness Month, and the reason why we have it is to bring awareness to minority mental health as a whole. Okay, so we know that when we think about all populations in America, what we know is that mental illness is affecting 1 in 10 adults, 1 in 5 adults and 1 in 10 children. So we know that mental illness really is a leading cause of disability. However, we also know that about 2/3 of the people with a diagnosable mental illness are not seeking treatment for that mental illness. We also know that that number is even higher whenever we look at minorities, okay? And so that brings us to mental health disparities, okay? This is partly why we have mental health disparities. Minorities are a lot less likely to seek mental health treatment, but also even when they seek treatment, they have less, even when they want to seek treatment, they have less access to mental health treatment and less access to quality mental health treatment. A lot of minorities are more likely to go to inpatient hospitals or more likely to show up to emergency rooms once the mental illness has become a lot worse, okay? And once they've tried to cope with it for a long time, all right? So that leads to a lot less quality care. That also leads to poorer outcomes, and that also leads to what a lot of people call the burden of mental illness, because it's a lot less cost effective if you're showing up to a hospital or if you're in an inpatient or if you're hospitalized in an inpatient facility for an extended period of time. So it's a lot more costly, it's a lot more intensive, and the treatment isn't as long going and continuous as is probably needed. Okay, so during this Minority Mental Health Month, my goal is really to increase awareness about minority mental health, but also to help us to have these conversations in our homes and in our communities about minority mental health. So that's why we have this month. That's my intention around having these live sessions, is to increase awareness and to hopefully help to address the mental health disparity whenever we think about minorities. So let's just start with some interpretations and barriers. And so when we're talking about these interpretations, I'm going to compare how minorities view mental illness, or how a lot of minorities view mental illness. I don't want to make these broad generalizations, and compare it to how a lot of white Americans view mental illness. So first, a lot of times with white Americans, they do have a medical perspective about mental illness, right? And a lot of times with minority communities, we tend to have more of a spiritual interpretation of mental illness, more of an interpretation that focuses on morality or more character. You've probably heard people even attribute someone's mental illness to their character, or to a character flaw, or to some type of spiritual deficit even. You may have even heard them, attribute it to them being possessed or demonic. And I've definitely heard that message preached from pulpits myself. And then also sometimes we attribute it to societal ills. So things like things that are happening in our communities, things, rape, molestation, violence, those types of things. And that's not wrong, because a lot of minorities are attributing mental illness or mental problems to these societal ills, or to spirituality, or to moral character. Is not to necessarily say that it's wrong. It's just to say that their understanding and their worldview and their perspective is different. Okay, and so as mental health professionals and as people working in communities, whether you're a teacher or a pastor, community leader, we have to understand how those interpretations differ, and how can we address those interpretations in a way that's going to be helpful and meaningful for folks. I do see we have Ms. Beasley on and Alonzo, so thank you both for joining. Feel free to fire off questions and comments as we go along. I'm keeping my eyes on the comments. I really like for these to be as interactive as possible. But when it's just me on them, I'm just firing away and talking. But hey, when we have folks on, I really want you to add in your thoughts, add in your experiences, add in your own personal expertise, ask questions. I want it to be a conversation. That's one difference in how a lot of white Americans and how a lot of minorities view mental illness, okay? Another difference is oftentimes white Americans are going to seek out professional help. And when I say professional help, I mean help from a mental health professional. So a psychologist, a psychiatrist, a counselor, a social worker. They're going to seek out help from a mental health professional. Okay. However, a lot of times in minority communities, folks are going to seek out help from a spiritual or church leader. They're going to seek out help from a family member, from a community member, or from a friend. Okay. And there's nothing that's wrong with that. Okay. However, when that's the only help that they're getting, it sometimes keeps them from receiving the quality mental health assistance that they really need. Okay, so when we think about it, a lot of times seeking help from these non-professional sources of support, like clergy or friends or family members, is really preventing folks from being able to get the type of help that they really need. Another important thing to note about a lot of minorities is when we do seek mental health assistance, we seek it a lot of times from primary care providers, which is a step in the right direction, but oftentimes that doesn't lead to ongoing therapy. It oftentimes leads to, and I have to be careful with this, it oftentimes leads to just a medication, okay, because they can't provide you with therapy, but just a medication, or it will sometimes lead to misdiagnoses. And there's some research that backs that up, but I'll just briefly go into sometimes the way that minorities talk about mental health. They might come in talking about anxiety, as you know, my chest is pounding, my heart is hurting, in ways like that. And so if the primary care physician isn't digging deeper and exploring whether or not there's a valid mental health issue there, then that mental health issue is not treated. Only the physical symptomology is going to be treated. And so that also makes it difficult, and means that, you know, that furthers that mental health disparity that I was talking about earlier. Hey, Sade. Sorry, I just got really excited. Sade, we've got to catch up. Um, Yes, the lack of competence is huge. And I would even say that in the same way that I am not going to go around diagnosing someone with diabetes or cancer, let alone trying to treat them, a lot of primary care physicians have to understand exactly where their competence lies. And when they need to refer someone to a mental health professional, do that. Okay, and it's sometimes okay to go ahead and prescribe a medication to help them cope with that anxiety, but be really clear in providing that referral to a mental health professional. Or when we're talking about seeking help in the community, a lot of times that's step one for a lot of folks, but we really need to be proactive in terms of helping them connect with a mental health professional as well. I definitely agree, Alonzo. And so those are just some of the interpretations or different ways in which we interpret mental illness between white culture and minorities, okay? And so I'm just going to give you just a couple stats. I had a lot of stats last time, but the stats are kind of dry. I'd rather get to more of the meat. So just a couple stats. A lot of times people say that, you know, therapy and self-help are really a waste of time. All I really need to do is go to my primary care physician and just get that pill and pop it and move on. I got too much going on to be sitting down in therapy talking to somebody about my problems. I already know about my problems. I just need you to help me cope with how I'm feeling. Okay, and I can take care of all of that with my primary care physician. I gotta go see him anyway about this high blood pressure. You know, I hear that a lot. And while I understand that your time is valuable, I also know that it is much more than that. Seeking help for mental illness can be as simple as taking a pill, right? However, you also may need therapy to dig a lot deeper and help you address the emotional issues that you maybe have buried over time, okay? That you maybe have, you know, normalized because they become so constant for you in your life. All right. So it's very important to know that sometimes you do need therapy and medication. All right. Sometimes you do need more than your family and friends as a support system for you. You might need group therapy. You might need individual therapy. You might need the expertise of a mental health professional to really help you be able to address the issue and have long-term sustainable change. A lot of times I hear, and I'm beginning to work a lot more with children again. And so a lot of times I hear people say things like, you know, children don't experience mental health problems. This is just us overdiagnosing these babies, misdiagnosing these babies, getting these babies labeled, right? And while I do understand that we definitely have some problems in our medical field and in our school system with misdiagnosing and overdiagnosing and mislabeling our minority children, I agree wholeheartedly there. Please understand that 1 in 10 American children, even if you're not talking about minorities, are struggling with some type of mental illness. Okay, so please understand that that is clinically diagnosable. Okay, it's clinically diagnosable. This is not, I am not pushing for us to continue to medicate and label and diagnose our babies. That's not what this is about. What this is about is understanding that children do struggle with mental illness that is clinically diagnosable. Okay, a lot of times, I think it's about half of the children before age 14 are going to show some signs, of a diagnosable mental illness. And most people, in fact, about 75% of the people are going to show clear diagnosable signs before the age of 24. So instead of us just writing off mental illness as being another way in which our kids are being labeled, let's be honest with ourselves and understand that mental illness does impact our babies too. So that's one that I'm hearing more and more about, and I definitely wanted to give some attention to that. Hey Timothy, hey Kristen, I'm so happy to have y'all on. I think y'all are both newbies, so I really appreciate you joining in and helping to increase awareness. So those are just some of the stats, some of the myths, some of the interpretations, some of the barriers when we think about mental illness in our communities and in minority communities. Recently, there have been 2 stories that I really wanted to talk about to help make this just more real for folks. And I know these are celebrities, but I still think it more so hits home for people when we talk about celebrities. So, Maia Moore. Recently, there was a viral video of Maia Moore at a gas station, a very disturbing video of a rapper really exploiting her, mocking, making fun of her in a very demeaning and disrespectful way as she begged for crack, and as she talked about some experiences that she's had. She looked disheveled. She looked bad. She looked as if she was struggling, right? And so I don't know if you all know about Maia's story, but Maia's story is one of having a tough time with her mom's death, having a tough time with her relationship with her mom, and having a tough time with bipolar disorder and drug abuse throughout the years. You may remember her from hanging with Mr. Cooper when you were younger. I know several of you are my age on here, and we definitely looked at that show and enjoyed that show. And so to see Maia in this state is disheartening. However, I think it brings to light several issues. Okay, we know mental illness is real, but we also need to recognize that mental illness includes drug abuse. Okay, and I won't get into this whole kind of piece around how we as a nation are showing a lot more compassion now towards people who are struggling with the opioid epidemic versus people who are struggling with the crack epidemic. There's a whole debate there, right? Rightfully so, we are showing compassion to folks who are struggling with opioid addiction because that is addiction, right? But we have to understand that being addicted to crack is also an addiction, and we don't show the same support there. We don't show the same compassion just as a nation there. Okay, sorry, my phone's ringing. We don't show the same support and compassion. But it's also important for us to be real with ourselves and understand within our own culture, within our own minority cultures, we are very stigmatizing towards folks who are addicted to crack. And so it's interesting to say the least how those are handled differently as a nation and within our culture, but nonetheless, the stigma is there. And so it's just really important for us to understand that mental illness includes drug addiction. It includes alcohol addiction. And it's very important for us to think about it that way and to be more understanding. Okay. I also wanted to briefly just talk a little bit about Nelsan Ellis. I remember him in The Help, but also I didn't look at True Blood, but I think he's most famously perhaps known from his role in True Blood. And all of a sudden we get news of him passing away. And his family recently provided us with information about his struggle with alcohol abuse, and how he has struggled, well, his struggle with drug and alcohol abuse, and how his struggle with drug and alcohol abuse caused him to have several different health complications, which ultimately, at least my understanding of his family's reports, is that those health complications, I think, led to some heart failure, which eventually led to his death, which caught his fan base completely off guard, right? And what's really sad about Nelson's story is he was too stigmatized and too shameful to come out about it. Okay. And that's because of all the stigma and shame around mental illness in our communities and in our nation. I think about how much more he may have been able to be helped himself, and how many other people may have been empowered by his help seeking story. But he was too embarrassed to talk about his struggle. Thankfully, his parents and his family, they're sharing his struggle with drug and alcohol abuse to help bring some awareness to the issue. But I think that just goes to show us that we have to be more compassionate when we're talking about mental illness. Um, so, I am going to stop there before I give you a parting message and a call to action at the end, just to see if there are questions. I don't think I missed any comments that I didn't get to. Yes, the stigma around mental health, Alonzo, and the role of substance use is very prevalent in the Black community. These stigmas are literally killing us. They are killing us. The last time I shared some stats about Black men are 4 times as likely as Black women to die by suicide. So we oftentimes hear, Black people don't do that. Black people don't do that. That's a lie. Black people do that. Black men are choosing much more lethal means to do it. Black women are not doing it nearly as often as Black men. And that's why when we compare deaths by suicide with the African American community in comparison to the white community, people think Black people aren't doing it nearly as often. But you got to look a lot closer at the data. But yes, they are killing us. And sometimes they're not killing us directly with suicide. They are killing us slowly. We're really struggling psychologically. Our families are struggling because we're not talking about it, because we're equating strength with our silence, because we're afraid to be vulnerable and transparent. But they are killing us. They really are killing us. A lot of Black women, there's been a lot of research about Black women struggling with high allostatic load, which is directly tied to a lot of psychological stressors that they've been dealing with in the long term. But yes, they are definitely killing us. Substance use is killing us. And a lot of times in our communities, we are, in a lot of ways, really making fun of the people from around the way who are addicted. Yes, we definitely have to be paying attention to these ills and how they're showing up in our communities, and having more conversations. And I know, we got to put the action piece behind what we're saying, but I think it starts with having the conversations in our homes and in our communities, helping our kids to understand mental illness, helping them to not make fun of family members who are mentally ill, or people who they see in the community, helping them, think about, normalize mental illness. It's a lot more statistically normal than you may think of. But helping us to really be more open to having these conversations, starting out in our homes, but we need to be having these conversations in our churches. We need to be having these conversations in our schools, even in our classes. We need to be having these conversations in our community organizations. We need to be having these conversations and helping people to feel more humanized. Yes. We are truly suppressing our emotions for sure. Thank you all so much for your participation and for your comments. I really appreciate it. I'm going to do a quick just kind of wrap up and call to action. I'm also probably gonna try to go live on my personal page. I feel like maybe I can reach more people. I've tried to keep this on the professional page, but I feel like maybe I can reach more people. I'm gonna talk more about the Maia Moore story. NAMI, which is the National Alliance on Mental Illness, which her mom was a co-founder of. How amazing is that? Um, and talk more about Nelsan and talk more about the young lady, although not a minority, but talk more about the young lady who called out of work and cited mental illness and how her boss's response to her was really empowering, and his, that story has gone viral. But I'm going to try that and see if we can maybe reach some more people. In the meantime, if you would share this video is not for me. This video is for all the people who have been really struggling with being silent. All the people who are struggling with getting someone in their family to understand them, to understand that they're not just seeking attention for the sake of seeking attention. They're seeking attention because they need some help. But share this video and help us to continue to have the conversation, and maybe it'll bring some more people to my page to help them get more of the resources that they need as well. So my parting message for you all who are here, which I doubt you all really need it because you're here, but it's important for us as a community to really stop equating silence with strength. Sorry, my computer's frozen again, so hopefully the live video hasn't stopped. But it's important for us to really stop equating strength with silence. We did this in my family, y'all. Just because you are silent about the pain that you are enduring does not make you strong. Okay? I'm not saying it makes you weak either, but just because you verbalize your pain or you verbalize your mental struggle, that does not make you weak. Strength and silence are not the same thing. And it's important for us in minority communities to stop equating the two. It's important for us to understand that we can be transparent. We can be vulnerable. We can talk about our problems. We can open up about our mental health struggles. We can seek treatment. We can take medication. We can pray. We can go to therapy. And guess what? We can do it all at the same time. We don't have to pick and choose which one we're going to do. We don't have to say, well, if you're going to pray about it, leave it alone. No, I can pray about it. I can go and see my counselor. I can take some medication. I can talk to my mama and my family about it. I can do all of that at the same time. And guess what? When we do it, we are more than likely going to empower someone else in our family, someone else in our friend group who's also struggling. We're going to empower them. You would be amazed at how many minority students are struggling with mental health issues and they never seek treatment until they go to college and they get away from their families and away from their communities. And that's because they're offered the protection of confidentiality. Why not help them seek treatment earlier? Just a question. But now my call to action for all of us is the next time we see some insensitive, some disheartening, disrespectful commentary or video on social media about someone's struggle with either drug abuse or some other mental health concern, I challenge you to call that person out who's sharing it. And you don't have to do it out in the open. You can just send them a message, and it doesn't have to be confrontational. I'm just asking for you to educate them in a gentle way, right? You can share it on your own page, but in a way to increase awareness, in a way to educate, and in a way to show compassion. Okay, so you can kind of take it one of two ways or both. You can kind of talk with that person, especially if you have a solid established relationship with them. Talk with the person who's sharing it to help increase their own awareness and help them to be more understanding and compassionate. And or you can share that same video on your own page, but in a way that is compassionate, in a way that is educating, in a way that is offering compassion and understanding, and in a way that is respectful. and not demeaning. So that's my call to action for all of you. Last week, my call to action for folks was to be honest with themselves and to recognize if they needed help and to go ahead that night and do something to help them get the help, whether that was confiding in a friend or family member, or seeking professional help, and also to reach out to a family or friend who they knew were struggling. But this week, it is to be more mindful about some of the stories that we're seeing on social media. Be more mindful whenever we're seeing our Facebook and social media friends talking about their own mental health struggles, and be really compassionate in our responses to those. Sorry, I missed some comments. Hey, Paula, I didn't realize you had joined. Thank you for sharing. Thanks for being here and also doing the work in the physical community you're in. Thanks so much, Kristen. I really appreciate it. I really appreciate that. Exactly, we have to reframe the terminology that we use in our community. We have to reframe what it means to be strong, black, a man, a woman. Yes. Um, it not only in our black communities, but in our Latino communities, in our Asian American communities, as well as in our Native American communities. So I didn't provide stats tonight. I don't think I don't even remember if I got to stats. I might have just skipped over stats. I'm not sure. But if I did skip over those, I'll include them next week. But Minority Mental Health Awareness Month focuses on those 4 ethnic groups. And it's really important for us to understand that in all of those communities, we are equating silence with strength. There's um, a lot of suffering in silence in our communities. Thanks so much. Thanks so much. Thank y'all so much. I hope it was helpful in some way, shape, or form. Please feel free, like I said, to share it, to invite some folks in for next Wednesday's session. I'm going to try to continue to get more folks just invested in having these conversations, and invested in increasing their own awareness, and invested in helping their family and friends and themselves to seek treatment when they need it. So take care, y'all. I really appreciate it.